Hello everyone, welcome to Saro Academy. Dear friends, today we will discuss about the evidence to study. Evidence to it is the key study of Saroglitazar. It's a phase 3 study and it is done in patients who are confirmed as having NFLD or NASH on basis of biopsy. So evidence to, dear friends, it's a phase 3 based on which the DCGI has given approval. Biopsy driven study in NASH patients. So, what is the aims of the study? Aim of the study is to determine efficacy and safety of saroglitazar 4 milligrams in patients with biopsy-proven NASH, and these patients are without cirrhosis. Study design: it's a double-blind, randomized, placebo-controlled study. Duration is 52 weeks, and the patient population in 102 adults. Okay, so as I said, this patient on the basis of biopsy, they had a NAS score of greater than or equal to 4 and they were without cirrhosis. So cirrhosis is grade stage 4 fibrosis. This patient had a fibrosis stage of 1, 2 or 3. They can have it. However, they cannot have stage 4 fibrosis and they had a NAS score of greater than or equal to 4. Okay. So what are the component of NAS score? NAS, on the basis of when the biopsy is done, a NAS score can be assigned to a patient based on 3 components. First component is steatosis, second is hepatocyte ballooning, and third is lobular inflammations. So please remember here the patient which were included had a NAS score of greater than or equal to 4. Inclusion criteria: age of the patient was between 18 to 65 years. They had histological confirmation of NAS. So biopsy confirmation of NAS was done. Patient lacked cirrhosis. They do not had. Such patients were excluded from the study. They had a NAS score of greater than or equal to 4, right? And one score should be there at least in each of the component, which out of the 3 components of NAS. Okay, so such patients were included in the study. Now what is the primary and secondary endpoint? So the proportion of patient in which the NAS score it reduced by 2 points at the end of 52 weeks, such patients met the primary endpoint, or this is the primary endpoint. What is the secondary endpoint? So reduction in individual components of NAS, then liver parameters or liver function tests and lipid components. So all this individual NAS, liver functions and decrease in the lipid profile, this became decrease in NFLD activity score, NAS score greater than or equal to 2 points was observed in 52.3% of patients without worsening fibrosis at 52 weeks in saroglitazar arm and 23.5% in the placebo arm. So the difference, if you see the p-value, it was significant, right? So 52.3% of the patient, they showed a decrease in a NAS score of greater than or equal to 2 points, and such patient also did not show worsening of fibrosis. So this much proportion of patient, they met the primary endpoint for the saroglitazar arm, right? 52.3 for saroglitazar and 23.5 for the placebo arm. So this difference, which definitely showed an improvement in the biopsy parameter, was significant. Difference was significant between the two arms. So there was a decrease in the individual components of NAS, which was a secondary endpoint. For example, 41% reduction in steatosis, 35% in hepatic ballooning, and 12% in lobular inflammation. Similar trend was also present in the liver function test and also in the lipid parameters. So the percentage reduction is shown here in the slide in the table, and this reduction is found to be significant. So thank you everyone.